therapy. So to find out exactly what is going on, we go to the best. She is a surgeon at SSM Health, SLU Hospital, and SLU Care, and specializing in breast cancer. Good morning and welcome back, Dr. Teresa Schwartz.
Thanks. Good morning to you as well.
All right, so what did they say over the weekend? What did the study say?
Yeah, this was one of the very few landmark studies that comes out that can change practice immediately, but it was a study that was trying to determine who actually needs chemotherapy if they have breast cancer, and women who have early-stage disease. So it was looking at about 10,000 women who had early-stage breast cancer, which is small tumors, hadn't yet spread to the lymph nodes, and also responds to estrogen or responds to hormones. And 30 years ago, we really didn't have a good answer. You know, everybody who had breast cancer got chemotherapy. And fortunately, we've been able to tailor our treatment recommendations significantly, mainly because of hormone-blocking pill therapy that we can use to say, all right, we're only going to give chemo to the people that we can show some benefit. But for a while, we really haven't known in these early-stage breast cancers who could be safe to avoid chemotherapy. And what this study has showed us is there are a lot of women, we're talking about 70%, give or take, of the women who have early-stage breast cancer don't need to have chemotherapy. The only thing they need to have after they finish surgical treatment is hormone-blocking pill therapy. So it allows us to save the toxicities and side effects of chemotherapy from a lot of women.
Doctor, we often hear studies, and they say in 2030, this might come to a doctor near you.
Exactly.
How relevant is it today to you and your practice and the women you see?
That's what's great about this study is that it is actually immediately relevant. So these are results that we can take to clinical practice today. So there isn't any delay. It's not going to be all right, we have to wait until we get further studies to make sure we've got the total story. With this study, we can actually use it right away. So for those women that we were previously on the fence and weren't sure if they needed chemotherapy, now we can look them in the face and say we have good research that tells us that you don't need to have chemotherapy, that it will not benefit your survival, and you can benefit from just taking hormone-blocking pills. And that's advice we can give right now.
So you're telling me that because of this study that came out over the weekend, you are changing the way you talk to your patients?
Yeah, absolutely. And, of course, this trial doesn't apply to all patients, so it's only a certain subset of women with breast cancer, but that's really the majority of what we see. So, again, it's early-stage breast cancer patients with small tumors, no lymph node involvement, the type of cancers that respond to hormones, and we can do these extra tests on the tumor itself to say, all right, how aggressive are you under the microscope? And these tests tell us, hey, this person definitely needs chemotherapy, or this person definitely doesn't need chemotherapy. But the people that were in the gray zone in this study, those are the ones that we were on the fence about before. Now we know that they don't need chemo. So it really does give us a lot of data and information to be able to pass along to patients to say that it's safe to avoid the extra therapy.
Dr. Teresa Schwartz, chemotherapy has changed quite a bit over the years. It's less intrusive, but still it's a chemotherapy. Where are you? I mean, put this into perspective. You as a breast cancer doctor and a specialist, how excited, how revolutionary, how transformative is this study?
Oh, it's amazingly transformative, and I know everybody who takes care of breast cancer patients is excited about the results of this study. We've honestly been waiting on it for years. They've been following patients on this study for 9 years now, so it's been a long time coming for us to be able to have good answers to tell our patients. Because what's tricky is that if you were seeing someone with an early-stage breast cancer that, gosh, I don't know if they need chemo, but I don't know that they don't need chemo, that's a tough conversation to have as a physician, but it's also a really tough conversation to hear as a patient because everybody wants the answer. No one wants to do anything wrong.
Right.
No one wants to make the wrong selection. So if you say, hey, we can give you chemo if you would like it, I mean, no patient knows what to do with that answer or that post-treatment plan. So the doctors don't like it either. We would much rather say, hey, we've got good research that tells us that you do need chemo, or we've got good research that tells us you don't need chemo. That's just a much easier conversation, especially when you have the research behind it to be able to explain to patients why it's safe to use those treatment routes. So I think it's going to make a huge difference in the comfort level of patients when they're hearing what the plan is, and also with physicians whenever you're giving advice.
Dr. Teresa Schwartz, we'll let you get back to work. Thank you for your time on a busy morning.
Absolutely. Thanks so much.